Blood pressure, the force exerted by circulating blood on the walls of blood vessels, is a vital indicator of cardiovascular health. It is measured in millimeters of mercury, mmHg, and is typically represented by two numbers: systolic, the pressure during heartbeats, and diastolic, the pressure between heartbeats. While blood pressure is commonly monitored during rest or activity, it also undergoes significant changes after a meal. These postprandial changes are driven by a complex interplay of physiological processes involved in digestion, metabolism, and hormonal regulation. Understanding these changes, particularly the phenomenon of postprandial hypotension, and their implications for health can be crucial for both managing existing cardiovascular conditions and promoting overall well-being. To appreciate how blood pressure changes after a meal, it is essential to understand the basic mechanisms involved in its regulation. Blood pressure is primarily controlled by the autonomic nervous system, which balances the body's sympathetic and parasympathetic responses. The sympathetic nervous system, SNS, typically raises blood pressure by constricting blood vessels and increasing heart rate, while the parasympathetic nervous system, PNS, lowers blood pressure by relaxing blood vessels and slowing the heart rate. The body's regulation of blood pressure is also influenced by the kidneys, which control blood volume through the excretion or retention of sodium and water, and by various hormones, including adrenaline, noradrenaline, and insulin. These factors work together to maintain blood pressure within a narrow range that is optimal for the body's needs at any given moment. One of the most significant ways in which blood pressure can change after a meal is through a drop known as postprandial hypotension. This condition is characterized by a decline in blood pressure that occurs within 2 hours after eating and is most common in older adults, though it can affect people of all ages, particularly those with certain health conditions. When you eat, your body must direct a significant amount of blood to the stomach and intestines to facilitate the digestion and absorption of nutrients. This process, known as splanchnic circulation, involves a substantial redirection of blood flow away from other parts of the body, such as the brain and limbs. To compensate for this shift and maintain overall blood pressure, the body usually increases heart rate and constricts blood vessels elsewhere, a response mediated by the autonomic nervous system. However, in some individuals, particularly those with impaired autonomic function, such as people with diabetes, Parkinson's disease, or other conditions affecting the nervous system, this compensatory mechanism is insufficient. As a result, blood pressure can drop significantly, leading to symptoms such as dizziness, lightheadedness, weakness, blurred vision, and in severe cases, fainting. Postprandial hypotension is particularly concerning in older adults, as it increases the risk of falls and related injuries. Several factors can increase the likelihood of experiencing postprandial hypotension. Age is a significant risk factor. As people age, the autonomic nervous system becomes less responsive, making it more difficult for the body to adjust to the demands of digestion. Chronic conditions such as diabetes, hypertension, and neurodegenerative diseases also impair autonomic function, heightening the risk of postprandial hypotension. Medications, particularly those used to treat high blood pressure, heart disease, and psychiatric conditions, can also contribute to postprandial hypotension. These drugs may interfere with the body's ability to regulate blood pressure, particularly after a meal, when additional demands are placed on the cardiovascular system. The type and composition of food consumed can have a significant impact on blood pressure, both immediately after a meal and over the long term. Different nutrients and foods can either exacerbate or mitigate postprandial blood pressure changes. Sodium is a well-known contributor to high blood pressure, particularly in individuals who are salt-sensitive or have hypertension. After consuming a high-sodium meal, the body retains more water to dilute the excess sodium, leading to an increase in blood volume. This, in turn, raises blood pressure. The effects of sodium can be particularly pronounced after a meal, as the body's natural response to food intake involves various shifts in blood flow and fluid balance. For individuals with high blood pressure or cardiovascular disease, consuming a high-sodium meal can result in a temporary but significant increase in blood pressure. Over time, consistently high sodium intake can contribute to chronic hypertension, increasing the risk of heart disease, stroke, and kidney damage. In contrast to sodium, potassium helps to lower blood pressure by promoting the excretion of sodium through urine and by relaxing the walls of blood vessels. Foods rich in potassium, such as bananas, sweet potatoes, spinach, and avocados can help mitigate the effects of sodium and support healthy blood pressure levels. A meal rich in potassium can have a mildly lowering effect on blood pressure, even in the short term. Over time, a diet high in potassium and low in sodium can contribute to better blood pressure control and reduce the risk of cardiovascular events. Carbohydrate-rich foods, particularly those high in refined sugars or processed carbohydrates, can also influence blood pressure. After consuming a meal high in carbohydrates, the body releases insulin, a hormone that helps cells absorb glucose from the bloodstream. Insulin also has vasodilatory effects, meaning it can cause blood vessels to widen, which may lead to a temporary drop in blood pressure. However, in individuals with insulin resistance, a condition common in those with obesity or type 2 diabetes, the body's response to insulin is blunted. This can lead to higher postprandial blood sugar levels and may exacerbate blood pressure fluctuations. Over time, poor blood sugar control can contribute to the development of hypertension and other cardiovascular complications. The digestive process itself places significant demands on the body's circulatory system, leading to shifts in blood pressure. As the stomach and intestines become more active after a meal, blood is directed away from other organs and tissues to support digestion. This can result in a temporary decrease in blood pressure, particularly in areas of the body not directly involved in digestion. The splanchnic circulation refers to the network of blood vessels that supply the gastrointestinal organs, including the stomach, intestines, liver, and pancreas. After a meal, blood flow to these organs increases significantly to support digestion and nutrient absorption. This increase in splanchnic blood flow can account for up to 30% of the body's total blood volume at any given time. To compensate for this shift, the body typically increases heart rate and constricts blood vessels in other areas, such as the skin and muscles. However, in some individuals, particularly those with autonomic dysfunction, this compensatory mechanism is inadequate, leading to a drop in overall blood pressure. This can result in symptoms such as dizziness, weakness, and fatigue after eating. In addition to insulin, other hormones released in response to food intake can influence blood pressure. For example, glucagon, a hormone that raises blood sugar levels, is released when blood sugar drops too low. While glucagon primarily acts to increase blood sugar, it can also influence blood pressure by stimulating the release of catecholamines, such as adrenaline and noradrenaline, which can raise blood pressure by constricting blood vessels. Conversely, the hormone cholecystokinin, CCK, which is released in response to fats and proteins, can have a calming effect on the nervous system, potentially leading to a slight decrease in blood pressure. CCK slows the emptying of the stomach and promotes the release of digestive enzymes, helping to regulate the pace of digestion and absorption. The extent to which blood pressure changes after a meal can vary greatly from person to person, depending on factors such as age, overall health, diet, and individual physiology. Some people may experience significant fluctuations in blood pressure after eating, while others may notice little to no change. As mentioned earlier, age is a significant factor in postprandial blood pressure changes. Older adults are more likely to experience postprandial hypotension due to the natural decline in autonomic function that occurs with aging. This decline makes it more difficult for the body to adjust to the demands of digestion, leading to more pronounced drops in blood pressure after a meal. In younger individuals, the autonomic nervous system is typically more responsive, allowing for more effective compensation for the shifts in blood flow that occur after eating. As a result, younger people may experience less noticeable changes in blood pressure after a meal. Chronic health conditions such as diabetes, hypertension, and cardiovascular disease can also influence how blood pressure changes after a meal. In individuals with diabetes, for example, impaired insulin response and autonomic dysfunction can lead to more significant postprandial blood pressure fluctuations. Similarly, individuals with hypertension may experience exaggerated blood pressure responses to high-sodium meals or other dietary triggers. Medications used to treat these conditions can also play a role. For example, antihypertensive drugs, particularly those that affect the autonomic nervous system or blood volume, can influence how the body responds to the demands of digestion. While short-term fluctuations in blood pressure after a meal are generally not harmful for most people, repeated episodes of significant postprandial hypotension can have long-term implications, particularly in older adults and those with chronic health conditions. In older adults, Postprandial hypotension poses a notable risk of falls and related injuries. As blood pressure drops after a meal, symptoms like dizziness, lightheadedness, and fainting can occur, making it difficult to maintain balance. This is especially concerning for those already at risk due to age-related declines in muscle strength, vision, and reflexes. Falls in this population can lead to fractures, hospitalizations, and a decline in overall health, often resulting in a loss of independence. Beyond the immediate risk of falls, repeated episodes of postprandial hypotension can exacerbate underlying cardiovascular conditions. For individuals with heart disease, frequent drops in blood pressure can place additional strain on the heart, potentially leading to arrhythmias, heart failure, or other complications. In those with pre-existing hypertension, the body's struggle to maintain stable blood pressure after meals can lead to more pronounced fluctuations, increasing the risk of stroke or heart attack. Given the potential risks associated with blood pressure changes after meals, implementing strategies to manage these fluctuations is crucial, particularly for those at higher risk. Here are some practical approaches. Smaller, more frequent meals. One of the most effective strategies for managing postprandial hypotension is to eat smaller, more frequent meals throughout the day rather than a few large ones. Smaller meals place less demand on the digestive system, reducing the likelihood of significant blood pressure drops. Balanced nutrient intake. A diet rich in fruits, vegetables, whole grains, and lean proteins can help regulate blood pressure. Incorporating potassium-rich foods, such as bananas, spinach, and sweet potatoes, can counteract the effects of sodium and support more stable blood pressure levels. Limiting high-sodium foods and avoiding large carbohydrate-rich meals can also prevent significant postprandial fluctuations. Adequate hydration. Staying well hydrated is essential for maintaining blood pressure stability. Dehydration can exacerbate postprandial hypotension, so drinking water before and during meals can help support blood volume and prevent sharp drops in blood pressure. Physical activity. Regular physical activity can improve cardiovascular health and help the body regulate blood pressure more effectively. However, it's advisable to avoid strenuous exercise immediately after meals, as this can further shift blood flow away from the digestive organs and exacerbate postprandial hypotension. Posture and positioning. Sitting or lying down for a short period after meals can help reduce the risk of dizziness or fainting in those prone to postprandial hypotension. Gradual movement from a seated or lying position to standing can also help the body adjust more smoothly to changes in blood pressure. Monitor blood pressure. For individuals at risk of significant blood pressure changes, regular monitoring before and after meals can provide valuable insights. Tracking these fluctuations can help in adjusting meal size, timing, and composition to better manage postprandial blood pressure. Medication adjustments. For those on blood pressure-lowering medications, it may be necessary to adjust dosages or timing to better manage postprandial hypotension. Healthcare providers can evaluate the need for such adjustments based on blood pressure readings and the individual's overall health status. Pharmacological support. In some cases, medications that specifically target postprandial hypotension may be prescribed. These can include drugs that enhance the autonomic nervous system's ability to maintain blood pressure or those that increase blood volume. Consultation with a healthcare provider. Regular consultation with a healthcare provider is crucial for individuals experiencing significant postprandial blood pressure changes. Providers can offer personalized advice, adjust treatment plans, and monitor for any potential complications. Blood pressure changes after a meal are a complex phenomenon influenced by multiple factors, including the demands of digestion, the types of food consumed, and individual health status. Postprandial hypotension, a common but often underrecognized condition, can pose significant risks, particularly for older adults and those with chronic health conditions. Understanding these changes and their potential implications is vital for managing cardiovascular health. Through dietary modifications, lifestyle adjustments, and, when necessary, medical interventions, individuals can better manage postprandial blood pressure fluctuations and reduce the associated risks. As with any health concern, personalized guidance from a healthcare provider is essential for those experiencing significant changes in blood pressure after meals. By taking proactive steps, individuals can maintain more stable blood pressure and support overall cardiovascular well-being, even in the face of the natural demands that come with digestion and metabolism. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more health insights. Stay healthy, and we'll see you in the next video.